Okay, we're going to wrap up this last talk. We should have time for questions and a little bit of panel questions. We're going to talk about understanding aging. I briefly touched upon this in the last talk, and it's just sort of understanding where aging goes. And if you look at this example here, the temptation is that there's dermatochalasis and brow ptosis, but if you really look carefully at this image, I think it's relatively controlled for position. You can see that there's actually the same height here and here, and the same height here and here, although it looks so obvious that the brow has fallen. And the skin is probably down about 1 millimeter, but it actually is retracted upwards about 1 millimeter on this side. What's obvious is the exposure of the orbital rim. So we have to start seeing differently, and what the goal is to start seeing negative space, starting to see things that are not there, instead of seeing things that are there. Like we think there may be a jowl here, but it actually is shrunken upwards onto the mandible. So it's just sort of seeing the opposite. A shorter time frame of early to late 30s, if you look at this, you can see that there's just more orbital exposure of bone, a little bit of exposure up to the upper cheek, that transition you heard Mark talk about, and then around the mouth is just more bone exposure. So it's rethinking what is aging. If you look, let's do this. If you think about aging from a different paradigm, I like to communicate this well to my patients that it's a glass of water emptying. I think it's an easy way for people to understand that. If you think of it that way, basically all it is that we're just losing fat from birth until death. Now obviously certain areas of our face with metabolic slowdown gets larger, but the majority around the periorbital region, anterior chin, starts to lose fat, and it's just a relative hollowing. And a lot of women are not necessarily enamored with the way they look in their early 20s because there can be too much baby fat. So, and if you try to even replicate that with a lot of volume, I think they just look too full, and it doesn't look right because you can't exactly reverse aging. So the goal is to fill that glass of water. If you're a younger person, you're putting less in. If you're an older person, you're putting more in. And in terms of volumes that I put in, if I'm seeing someone in their mid-30s even or late 30s, I'm putting maybe 15 to 20 cc's in. And this is a lot more conservative volumes, but everyone has different volumes to get different results. And if someone's older, I may be putting 45 to 50 cc's in. And it's just an overall way of thinking. I want to talk to you a little bit about what we heard Mark talk about, blink effect, and I think it's really how do we judge someone's age even at 20 to 30 feet away. And it has very little to do with rhytids, it has very little to do with hanging skin, it has to do with facial shape. And so what you see is that from a distance, someone that's very, very young, a child, a baby, has a very, very round face. And as we continue, that roundness maintains itself through the teenage years, no matter how thin the body is, and even into the early 20s, it's still quite round. As we start to lose volume into our mid-20s, there's this hybrid effect where you're starting to have some buccal suppression that begins in our late 20s to early 30s to become more dominant as a triangle, and then there's greater further suppression by our early to mid-30s. And if you ask most women, they actually like themselves in their early to mid-30s because they're a little bit more sculpted than their early 20s. As we get older, we start to lose volume to the anterior chin and to the upper recess of the cheeks, and we get bonier along the mandible area. So there's squaring effect of the face that's a masculinization process. So if you think about men as they get older, they become more masculine, and so do women. So you want to be careful in particular when you're working with men and making them too feminized by making them too youthful. And that's a discussion that you have to use some old photos to determine. And then there's an inversion where the lower face starts to dominate, and you start to get that line that you heard Mark talk about. We go down to the lower portion of the face, and there's a dominance of our lower face, and that triangle becomes accentuated. And with greater periorbital advancement and hollowing into the mid-cheek and around the eyes, into the anterior chin and the buccal recess, there's a full inversion of the triangle. And that's what we see even from 20, 30 feet away. We've already made our judgment. And that's what I see when my patients come through the door. I've already made my judgment about my work 30 feet away, because either it looks good or it doesn't from that distance. So the goal is inverting the triangle. We're going to talk about a little subtle change, and what I like to think about actually is more of an ovalization. And this component that bridges the cheek to the chin is the buccal zone, which to me is a very, very important area to create sort of a nice natural oval that's a transition sort of between the triangle and the circle. So creating ovals, designing facial balance. I don't think it's rocket science to do this, but it is something that if you start to train your eye, you start to see differently. An example of a lady that has very, very strong cheekbones. So this is actually avoiding the cheekbone and filling more into the central face, a little bit of buccal transition. So if you fill around the cheek itself, this cheek actually looks smaller and more blended into the face. The anterior chin component, I think an area that we tend to forget because we always are focused on the jowl and low down here, but the absence of tissue near the mouth across here, not the fold, but the bony exposure here is actually what accentuates aging. So a padded chin can look very dynamically youthful. 48-year-old lady here, if you look at it, teaching you negative space is to move away from an eye bag or steatoblepharon, moving away from dermatochalasis and a brow ptosis, and even a jowl. Because what you're seeing instead is an exposed orbital rim, a deflated brow, a full lower cheek where this is starting to empty out, and bone of the anterior chin. And so we're seeing differently. The goal today is to see negative space. And I really think that buccal transition point here allows me to get a more fluid transition into the lower face. So the more you think about transition zones of the face, I think the better that you're going to start to see how to rejuvenate a face. This is the opposite. This is taking a face that's relatively wide in aspect and actually narrowing it by avoiding the buccal space and putting more in the pre-jowl, anterior chin, anterior cheek, and into the brow. And I would say the lower eyelid's a little bit underdone, but you can sort of see overall the effect of getting the right balance, and the face just looks thinner. The goal is to say is how does light interact? You heard this earlier, and I want to sort of have you think about, this is so critical, is that's how I really think at even 35 feet away, 25 feet away, you can tell someone's age, well before you can see a single righted. It's about how light interacts, and the way that I like to think about it is that we don't want to look like Nick Nolte after a bad night out on the town. And it's about, the concept is that if you really think about it, when there's volumetric collapse of the face, we never look good. If we create the right volume balance of the face, no matter what makeup we have, what sleep, we always look good. And that's the way that light interacts. Well, how does light interact with the skin is the question. Well, it's quite simple. It's top-down. So if you really think about this, we live in a world with always top-down lighting. So if you think about what that means to you, is that if you can get in a situation, except at Neiman Marcus dressing room, you want to get a beautiful result in the situation, whether it's outside or inside. So how does light interact with the face? Well, if you think about it, deflation of the face creates more shadows. And if you're just lifting this deflated balloon, you're creating actually more shadows at certain times and less shadows elsewhere, whereas filling in all these transition points we talked about creates uniformity, and that's how light interacts better because it's top-down. So if we live in a world with top-down lighting, the way that I photograph my patients, if you say, well, he's not using consistent lighting, I am. It's actually a room with no ambient light, no flash photography, a uniform embankment of lights across it, and it's actually real-world simulation, in my opinion. It's so important, and you should judge your work not close up. Well, of course, part of that, but you need to judge it at a distance, and that's where I want you to think about. How does fat last? And there's this controversy that it just is just some kind of Restylane filler. It absolutely is not. If it's done well, it actually is longevity. I like the saying that the only complications you get are when fat survives. And the best way to think about it, I do a lot of hair restoration. I start to think of fat in the model of hair. And I was reading Unger's book, and I was thinking neovascularization for a hair transplant starts at about 6 months formally. And of course you go through these other phases of primary, secondary, and osculation, but you get neovascularization formally being very, very robust at 6 months. And I started to really rigorously look at my photographic evaluation of my patients, and I started to see the results actually uptick at that point. So the goal is to say, how do I see volume shifts over time? The trap we fall into is at 3 months we go, uh-oh, it didn't survive. What we don't do is follow them over years. And so the problem with this is, in my opinion, we can get them overfilled at this point when we get into the 5th and 6th year across this way. So the way that I like to communicate with my patients is that there can be a dip, and expect it. And if they expect it, they won't be worried about it. And so I see my patients at 1 or 2 weeks who look dramatically overfilled. At 3 to 4 weeks, in my opinion, they look pretty darn good, and sometimes too good because all the wrinkles are stretched out. And then at about 3 months to 6 months, they're in this dip phase where the fat cells shrink a little bit, but the formal blood supply really begins somewhere in the 4th, 5th month, and it continues with a trajectory up to about 18 months to 2 years. And so long as there's not excessive aging that occurs over that 2-year arc, they're improving and improving. And then what happens, like that glass of water idea, there's just a little bit further aging. And again, all of this has to be factored into the idea that they're actually aging like this the whole time, but there's just this little arc of improvement. So some photographs to show you this. A lady that's 48 years old, she already had a iridectomy, didn't quite deliver because she's actually volume depleted. And this is about a week out. You can see, even though it's very robust, there is youth through that overfilled look. And a month out, even though it may look a little robust, it looks very, very soft and youthful. And about 3 months, this is an example of, I want to show you two extremes. The two extremes are one person that really has not much of a dip. This is a lady that has very little dip. And even at 6 months, where it may have dropped a little bit later on, it's not bad. And if she was left with this result, I think she would be quite happy. But if you start watching this, at 11 months, it starts to pick up. And at 15 months, you can see how soft it looks. And this is without eyelid surgery, facelift, and all that. It's just a soft fill to the face. This is my worst example, someone that truly, truly dips hard. This is a week out, and it looks youthful but slightly distorted. As we get into the 3-month phase, I would say this looks almost the same. And the way that I phrase it for my patients is, picture these two, you are having lunch with this person, having lunch with this person. Your blink effect is that both of them look about the same. But as we get into the year margin, you start to see the way that light interacts with this face is tremendously different. The camera is even almost changing the metering here. And you can see that there's a glorious look to the face. But has it truly succeeded? Because our measure for success is that every little nook and cranny is perfect. And I would say she was actually ecstatic with her lower eyelids, but if you look at this consistent photograph, this is a failure. But is the face a failure? And the problem of what we try to do is articulate the face into tiny little pieces. And my goal is to have you judge the face just like you would judge someone socially. You don't judge their tear trough. You judge their face from a social interaction. And I call this a 5% rule, which is the idea that if fat is done well, if you hit enough little places, the face looks really, really nice, even though little tiny pieces don't quite make it. So the way that I help my patients understand this is I use the paradigm of a bed. I say that fat is your mattress, and fillers are your duvet, and Botox and lasers are your sheets. And if you think of it that way, they won't look at this as a failure. They'll look at this and understand that, hey, I just look great. Now, if they don't look great and we haven't hit that wow effect, that's when we come back and add a little more fat, and I don't charge them for the touch-up. This is a lady at about a month. If we follow her over time, this is about 3 months, and she doesn't dip too much. 9 months out, it's starting to grow. At 1 year, and then about 2 years out, it just starts to blend even further. This is a gentleman where I'm more conservative with volumes. I think we have to be more conservative with volumes here. This is a week. And at a month, it's not bad, but it's starting to dip. At 3 months, it almost looks the same as preoperatively. At 6 months, it's starting to improve. As we get into the 9-month range, again, nothing is perfect, but the person looks better. And about a year out, the way you interact with the person on the right is different, but you want to keep conservative with men because they look better with lower volumes, in my opinion. This is a week out. 1 month out. These are all without touch-ups. 9 months. 2 years. And you can see that it really holds well if you just are conservative with your volumes. And you've heard the book. Hope you can join me in St. Louis for a hair course. It's really great in July. And I appreciate your attention. Let's spend a few minutes. I got a couple minutes here to ask. Why don't we just go to the questions now? We don't have that much time. Anyone have any questions here that they want to ask? Yes.